Each patient reacts in a different way to surgery. You may have a drain in your knee after surgery. Some patients will have a Dayval placed to reduce the inflammation and pain. This also decreases the risk of infection. Some patients require IV fluids until they're able to drink and go to the bathroom on their own. You will have a short course of IV antibiotics to help prevent surgical site infection. Many patients experience constipation after surgery. It's generally a normal bodily reaction to the anesthesia. There are ways to manage it, and we will provide you with information. One of the most important areas when it comes to treatment is self-care assistance. We will monitor you while you are at the Orthopedic Institute. Based on your specific surgery and condition and our specialized orthopedic knowledge, we will put together a self-care assistance program you can use at home. Every surgical patient on their post-op day will be bed alarmed for their safety. The medication you receive makes you sleepy and sometimes disoriented. It's important that you follow recovery instructions provided to you upon your release. Your coach can provide a major support for you in your recovery at home. Other areas of self-care include your diet and your medication intake. You will be given a blood-thinning medication to help prevent blood clots. These are to reduce your complications related to your surgery. Take the correct dose at the same time every day and take the entire dose. While you're taking blood-thinning medications such as Coumadin and Lovenox, do not take aspirin or medications including aspirin such as Motrin or Advil. Avoid drastic changes in the consumption of foods that are high in vitamin K, which are green leafy vegetables. Avoid drinking grapefruit or cranberry juice. These affect how your medications are metabolized in your liver. You'll also be asked to come in for a blood test, or we'll set up home health to do your blood test. It's called an INR, which measures the clotting factors in your blood. Your medication dose will be adjusted depending on that lab. Take the correct dose at the same time every day, which we recommend that you take it with your evening meal. The entire dose needs to be taken at that time. Your dose will be adjusted often. It's helpful to record it on a calendar as it changes. What do your lungs have to do with your knee replacement? Plenty. That's why we'll show you how to use a spirometer, which is a lung capacity measuring device, and give you goals to set while you're in the Orthopedic Institute and when you go home. Here's why it's so important to get your lung capacity up. Using an incentive spirometer clears secretions out of your lungs to prevent pneumonia. This device ensures adequate oxygenation to the body to promote healing. Keeping your lungs inflated prevents the secretions from forming, and will encourage you to use this device 10 times an hour while you're awake. It takes a little time, but it can make a big difference in the speed of your recovery, and it helps prevent complications. TED stockings are a compression stocking to squeeze your blood back up to your heart to prevent blood clots. Wear them at all times except for a few short breaks while you're in the hospital. At home for 6 weeks, wear them in the daytime, but take them off at night, hand wash them, and hang them to dry. While you're in the hospital, we will use flotrons, which are sometimes called SCDs, to mechanically stimulate the blood flow. This machine simulates walking by squeezing your calf muscles and pushing blood back up to your heart. This action prevents blood clots from forming.